Good morning. I'm Pat Living with the Department of Health and Social Services and your moderator for the COVID-19 update for Wednesday, June 23rd. We are joined today by Yukon Premier, the Honourable Sandy Silver, Kwanlin Dunn First Nations Chief Doris Bill, and Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. Our sign language interpretation is provided by Kevin Klein and our French translation by André Boursier. Following our speakers, we will go to the phone lines for questions from reporters and reporters in the room. We will call you by name and you will each have 2 questions. Premier Silver.
Thank you very much, Pat. And hello, everybody, and thank you for joining us here on the traditional territory of the Kwanlin Dunn First Nation and the Ta'anquatching Council. I'm very pleased to be here today with Kwanlin Dunn First Nations Chief Doris Bill and also our Chief Medical Officer, Dr. Hanley. We're still dealing with an outbreak of COVID-19 in the territory, and this time it has touched nearly all of our communities. We have seen more cases in the last 14 days than we have in the last 14 months. I know that this is concerning to folks, but it's important to remember that we know how to live with COVID-19. We have been living with it for well over a year now, and we will most likely continue to deal with it for years to come. The fundamentals remain the same as they did when we had no cases. Tracing and testing are essential to containing the spread. So, if you are experiencing symptoms, please arrange to get tested. Symptoms include anything from fevers, chills, coughs, difficulty breathing, shortness of breath, runny nose, sore throat, loss of sense of taste or smell, headache, fatigue, loss of appetite, nausea and vomiting, diarrhea, and muscle aches. Anyone experiencing any of these symptoms should self-isolate and arrange to be tested immediately. It is vital to controlling the spread, so please do not hesitate to get tested. We have increased our testing capacity and have made it more convenient. You can call the COVID-19 Testing and Assessment Center at 867-393-3083, or online booking can happen to arrange for testing. Follow the links on yukon.ca. We have also opened a drive-up testing option at the center that is available from 6:30 till 9:30 p.m. each day. Folks in rural communities can contact their rural community health centers to arrange for testing. Dr. Hanley and his team are conducting a community-by-community risk assessment to ensure we're providing expanded testing when and where it is needed. Testing turnaround times remain very quick, roughly 24 to 36 hours, and negative tests can now be accessed online for faster access to results. Again, just follow the links on yukon.ca. When positive test results come in, that is when we move to contact tracing. A little bit about this. Contact tracing is done by the Yukon Communicable Disease Control, or YCDC, and also by Yukon Community Nursing. When somebody tests positive for COVID-19, these public health professionals work with them to help them to remember everyone that they've had close contact with during the time when they could be spreading the virus. These people are known as contacts. The health professionals then get in touch with the contacts to let them know that they've been exposed to COVID-19. YCDC and the Yukon Community Nursing will provide contacts with information, education, and support resources, and specific direction on what to do now, including what signs and symptoms to watch for, and how to access timely testing if required. Contacts will not be given the name of the person who may have exposed them. If the person is outside Yukon, we get information from the jurisdiction where they live about where they went in Yukon and follow up with those contacts. If someone from YCDC will phone you if you're a contact or someone with COVID-19 was in your business for longer than 15 minutes. In some cases, Not all contacts can be traced because we don't have enough details about where an infected person was, but not enough information maybe as well to know who was in close contact with that individual, or we're just simply unsure about exactly where an infected person was. In these cases, Dr. Hanley and his team will issue a public notice and identify their locations that they visited or may have visited by the person that was infected by COVID-19. So this information about contact tracing comes directly from the Yukon.ca website, all that I just said. This is where you can find the most accurate and up-to-date information about COVID-19 in the territory. I know a lot of people rely on social media and go there to connect with their friends and to talk about what is happening in their lives. But I hope you're also, if you have questions on COVID-19, then where you're going for your information is to the government website at yukon.ca. It has the most accurate and up-to-date information, including these details about contact tracing, about why we contact certain people, why we do public notifications, those types of things. This is the same approach that we use for every positive case in the territory, in all communities. It's the same approach, and it has worked phenomenally well so far. At this point, I really do want to thank the team at YCDC and also the community nurses for all of their hard work throughout this pandemic. This is absolutely the work of heroes, and we owe them all a debt of gratitude. If you are contacted by YCDC or by community nursing because you received recently a positive test or because you are a contact, it's really important that you're honest and open with these officials to ensure that they can do their job properly. They are professionals in their field. Contact tracing is absolutely essential to containing outbreaks, and these people are there to help you. They're there to help your friends and your neighbors stay safe. When it comes to keeping yourself and your loved ones safe, the best thing you can do right now is to get vaccinated. The vast majority of the new cases that we've seen, 85%, has been people that are not vaccinated. Like I said last week, unvaccinated individuals are at much greater risk at this stage of the pandemic. COVID-19 spreads much more easily amongst those who are not vaccinated. Without the protection of the vaccine, you are also at much greater risk of having more severe symptoms that can result in hospitalization and tragically even death. The few fully vaccinated individuals that have been affected have had relatively mild symptoms. No one wants to get sick, that's for sure. But you can take steps to protect yourself from getting seriously sick and potentially needing intensive care. The vaccines provide the best level of protection that is currently available to fight this disease. If you're not yet vaccinated, you need to make an appointment. We have enough vaccines for everyone who wants one. We are also extending youth vaccine clinics. The clinics will be continuing to offer first doses for youth on an ongoing basis. In communities, youth can receive their first dose at the next community clinic. In Whitehorse, youth can book an appointment online or walk into the clinic at the convention center. Appointments can be booked online at yukon.ca/thisisOurShot. And again, if you have any questions about the safety of the vaccine, please reach out to your doctor or community nurse. Or talk to folks you know who have received the vaccine. Ask them about why they took their shot. I want to thank my cabinet members and leaders throughout the territory, including Chief Bill and Dr. Hanley, for getting immunized and talking about it publicly. Chief Bill said it best, and I quote, "I got my shot, now it's your turn," end quote. Getting immunized is the best thing you can do to protect yourself and protect your family, your friends, your colleagues, your neighbors, all Yukoners. The vaccine will provide our way through this pandemic. COVID-19 is not going away anytime soon, folks. But if we maximize our immunization rates, we can live with it in a way that keeps our territory safe and healthy. I said earlier that the fundamentals remain the same when it comes to this pandemic, and that includes protecting yourself and others by practicing the Safe Six. Wash your hands often. Maintain physical distancing. Stay at home if you're sick. Travel responsibly and respectfully. Self-isolate as required, and follow the gathering guidelines. We know that people have not been following the Safe Six, and that has contributed to the current outbreak. If we let our guard down, the virus will spread. But we also know how to follow the Safe Six, and that's what we've been practicing for months on end. We have to continue practicing the Safe Six +1. Masking up is still a simple thing that you can do that makes a huge difference. The last thing that I'd like to address before passing it over to Chief Bill is events. As you know, the Porter Creek Senior Secondary School prom event had to be canceled due to a member of the grad class receiving a positive COVID-19 test. This was disappointing news for many students and families, but it was important to protect their health and safety. This is the only event the only event that has been canceled due to public health reasons. We have not changed any restrictions around gatherings or events. What is most important is that people follow the Safe 6+1 for the guidelines that are in place, follow those as well. I know that there are a lot of events planned this summer, and I hope that they will continue, and that goes for summer camps as well. Many groups and organizations have organizational plans for their events that have been reviewed and approved by the Office of the Chief Medical Officer of Health. These events can continue as before. If people are thinking about organizing events but don't have an operational plan, you can work with Dr. Hanley's office to get one approved. We're going to be living with COVID-19 for a long time yet, and we need to get comfortable with this new reality. As I said, we know how to live with COVID-19 because we have been doing so for months. We need to recommit to practicing the Safe 6+1. We need to keep the health and safety of our fellow Yukoners in mind in our actions, but we also need to continue to live our lives. The Fireweed community market is now happening, starting tomorrow. It's a great place to connect with folks outdoors and to support local farmers, artisans, and food vendors. These kinds of events are so important to our quality of life here in the territory. Getting out and connecting with people is really important for our mental health. Just make sure you're doing it safely, folks. Stay kind, stay patient, and continue to support each other, and we will absolutely get through this together. Thank you very much.
Thank you, Premier Silver. Chief Bill?
Dunjay, and thank you for inviting me here today alongside Premier Silver and Dr. Hanley. I want to thank everyone who is working hard to contain this outbreak. I would like to start by sending my best wishes to everyone right now who is sick with COVID-19 and to everyone who is having a hard time dealing with this reality. I know that many people are hurting, scared, feeling down. I invite everyone now to step back, take a deep breath, and think about what's important. Think about what's most important to you. What do you hold dear? For me, it's my family, my friends, and my community. I want to show up for them, do the best that I can. Since the pandemic began, I know I've been missing things from my life. Things like traveling, hugs, and gatherings. And now that we're in an outbreak situation, some of those things seem farther away than ever. The only way to turn that around is for all to present a united front against this virus. All of us, as Yukoners, can do our part. And it takes just a few simple steps. First, get vaccinated. Whether you're 12 or 112, it's the best thing you can do to protect yourself and the people around you. Second, follow the Safe 6+1. That means keeping a 2-meter distance from anyone outside your small social bubble. It means self-isolate when you've been asked to. And this one is really important because this is where we see transmission happening in the Yukon. No gathering or parties. That means now is not the time to invite people to your house. Now is not the time to go house to house partying. Now is not the time to have a gathering or party or even a bush party. Third, get tested if you have COVID-19 symptoms, especially if you're not fully vaccinated. And lastly, it's more important than ever that we be kind to one another. Many people are going through difficult times. Now is the time to be supportive and lift each other up. And if you need mental wellness supports, reach out for help. It's okay to ask for help. We've all said these things before, and I know you've heard them before. But this time, I invite you to think about why it's important. Who needs you to be there for them? Who will you embrace when this outbreak subsides and we learn to live with COVID-19? Where will you travel? What is your why? Gunas cheese, Shoni Thun, Masicho, thank you, and please be safe. Gunas cheese.
Thank you very much, Chief Bill. Dr. Hanley?
Thank you, Pat. Thank you, Premier Silver, and thank you, Chief Bill, for your wise words, as always. As the Premier says, 14 days, and we've seen more cases than in the last 14 months. An explosive rise in cases is part of what happens in an outbreak. Many cases in the beginning, and then a leveling off as we proceed on the journey of methodically finding cases, isolating them and their contacts, managing any clusters or associated outbreaks, and gradually reestablishing control and containment. For the moment, with a high number of cases in the unvaccinated population, we need to continue to take an aggressive approach to test and find cases of COVID-19 throughout the territory. This outbreak is a harsh reminder that as we follow the path forward, we have to proceed with care and continue to abide by whatever public health measures are in place at the time. I'm going to spend the next few minutes overviewing our current situation, what this means for Yukoners, and what we should expect over the next days and weeks. As I mentioned last week, getting exact numbers are always in flux during an outbreak, as we get new information on cases and recoveries throughout the day. But what I'll tell you is our status as of this morning, and by this afternoon when the official numbers are posted, those numbers may be slightly different. So in this outbreak now we have a total of 144 cases. That's from June 1st to present. And active cases now are at 103. We have a total of 5 people hospitalized, 3 who are still currently in hospital, 1 of whom is out of territory in intensive care. 2 locally, 1 who is stable and 1 who is more serious, in more serious condition. The spectrum is that the two cases we had that were medevaced out, the 1 in serious condition here are all unvaccinated. Those who have done better and are stable have been either partially vaccinated or fully vaccinated in our last case. So in terms of vaccine status, 122 out of 144 total cases unvaccinated, which, as the Premier said, amounts to 85%. Our age range from 1 to 90 years old. And all of the screenings that have taken place, I think there are 26 so far, have all screened positive for the Gamma variant. So the number of people fully vaccinated that have been affected in this outbreak is 8%. And as I say, all but one of those have had mild to very mild symptoms, the one exception being an elderly individual currently in hospital in stable condition. So this continues to be an outbreak that seeks out susceptible hosts, young people and the unvaccinated. All cases, as I said, that have been screened are coming back as the Gamma variant, suggesting a unique source, and that this is ultimately one large outbreak. The total number of unique contacts to cases is over 550. So many people have either been self-isolating or self-monitoring in order to help contain the spread. So we are seeing widespread transmission of infection around the territory, seeded into multiple communities from people attending the parties and gatherings in early June. Although we have seen some cases not linked to others or to a clear source, about 90% of cases are linked to known cases or clusters. However, not every chain of transmission has been identified, meaning that some people may get sick with COVID without necessarily knowing that they have been in contact with the infection. And that's why if you're sick, it is so important to seek testing as soon as possible. In summary, we're facing a new challenge, our most extensive outbreak by far, but in a territory where well over 70% of adults are fully vaccinated. What does this mean for Yukoners exactly? Well, first, I want to prepare you all that we're going to see more cases. And although I believe that we have now moved past the initial rush of cases associated with the gatherings, which are now about 2 weeks past, our case counts will continue to grow for a while as ongoing transmission and even smaller clusters or outbreaks may occur. So what's our strategy to managing this outbreak? And I'll say it lies in a few key areas. One is, as the Premier described, the case finding and contact tracing. We want to find people who are infectious and isolate them and their contacts to prevent others from getting infected. Testing. We're looking for cases in anyone with symptoms. That's why we're asking people to come forward who have symptoms and get tested, especially those who are as yet unvaccinated. That is who is mostly getting infection and then passing it on to others. Testing may also involve ring testing or asymptomatic testing if we have evidence of multiple exposures in confined settings, say a household or an isolated community or a group setting. The third is analysis. We're continually putting together the information on where people are, who their contacts are, to draw maps of transmission so we can understand what is driving the outbreak and where we need to intervene. So far, gatherings and onward contacts, such as household or family or close social contact, have been the main routes of transmission, involving in some cases multiple contacts in communities, whether in Whitehorse or rural. The fourth is vaccination, and we continue to offer vaccine wherever we can, and we are seeing a significant increase in demand in both Whitehorse and rural Yukon. Public measures. In this case, we're not so far seeing ongoing transmission in other settings, such as sports events or camps or restaurants or gatherings, apart from the initial ones. So I'm not recommending reimposing any of our restrictions. However, we really need to reinforce what we already should be doing under current measures and orders. And these include inspections to bars and restaurants to ensure that clients are cooperative with current regulations on seating, mask use, and crowding, and other aspects. We need to be reinforcing and supporting people who are self-isolating. We need to reinforce the need to screen kids who are sick out of day camp arrangements. And I'll talk a bit more in detail about that later. And the same rigorous screening should apply to workplaces. And communications, of course, keeping you apprised of what is going on, reminding you about getting tested, where to get tested, where to get vaccine, how to observe self-isolation and what it means, what to do when you get a positive or a negative test, how to get supports when you need them to get through self-isolation or a difficult day. And then support to communities in terms of communication support, logistical support, testing, vaccine, just conversations and moral support as well. So I'm going to elaborate on a few of those key features. Of course, the role of testing and isolation is going to be a key part in our approach. And testing is a critical tool that we will need to continue to use as the days go on. And I do want to thank all of the Yukoners who have come forward to get tested, many hundreds now. And I would like to continue to stress the importance of booking an appointment and getting that test. You may think you have a summer cold. Perhaps it is. You may think you have, but you may think it's just a sore throat. But any sore throat or sniffles could be COVID-19 at the moment. If there's one takeaway from today, it is that if you're sick, self-isolate and arrange for a test, especially if you are not yet fully vaccinated. As part of our testing strategy and outbreak containment, we are responding in various ways to the needs of communities based on their requests and risks associated with COVID in the communities. Remember that at present, COVID is present in most communities and could easily be circulating, unrecognized in others. We want to support the communities and be present with them as they go through what can be a frightening and traumatic experience. We will be working closely with communities who are at risk for additional exposures and ensure that a testing approach can be added to existing testing capacity if needed. For example, we can deploy rapid testing through the use of the Abbott ID devices that can return test results in a matter of 15 minutes. But remember that for the last year and a half, testing has been accessible from every health center or hospital in the territory. All communities have been testing more, and drivers have been working in extra shifts to run samples back and forth from the communities. I want to thank all the community drivers who are making repeated long journeys to retrieve the swabs and get them sent to BC for an ongoing, quick turnaround of results. The online results system has now allowed many people to get their results earlier. Testing is just one of the ways that we're working alongside communities to ensure that we do our best to protect the most vulnerable and unvaccinated populations. Now, in Ross River, we actually are testing this afternoon with rapid testing using the Abbott ID, and that's Wednesday, Thursday, and Friday afternoons between 2 and 5. And this is at the same time that the youth clinic for the Pfizer vaccine is running in Ross River today, and at the same time the Moderna vaccine continues to be available through the health center there and in all our other health centers. As for self-isolation, if you have been advised or directed to self-isolate, it really means self-isolate. This is not optional or when you feel like it. Self-isolation is an order under Yukon's Public Health and Safety Act. We have seen transmission in this outbreak from cases to contacts within households when self-isolation rules are not followed. You have to stay separately and not share any common space. Do not breathe the same air. Remember, with this variant, there is no forgiveness. The P1 variant will easily spread to all members of one household if self-isolation is not strictly adhered to. There is no room for mistakes with this variant. If you're unsure what to do, how to do self-isolation or need a safer place to stay, do reach out to call COVID supports for help. Now, vaccination, as the Premier and Chief Bill emphasized, continues to be our best long-term protection against this virus. Vaccines present us with the solution to combating this particular infectious disease. And the more Yukoners who are immunized, the less likely we are to spread the virus to one another. Even if you don't feel the need to get the vaccine for your own benefit, getting the vaccine can indirectly protect people that you love and live with, or work with, or share any space with. One key lesson from this outbreak already is how well we are protected with vaccine and how much worse off we would be right now without it. Remember that the path forward means that vaccine gradually replaces border controls as our way to strengthen the foundation, that is, to collectively protect us as a society against COVID infection. Still, we do have many people in territory who are vulnerable. Even though the impact would have been far worse a few months ago when no one had vaccine, there still are a few people getting quite sick. As I said, 2 people have been medevaced out of territory. 3 others now have been admitted to hospital. And of these 5, only 1 had partial vaccine, 1 fully vaccinated, and the rest had none. And this is the same story as we have seen throughout the vaccinated world. Now, vaccine may yet have an impact in helping us to get out of this current outbreak. But more important is that a high vaccine uptake in Yukon will help us to prevent, or at least to reduce, the threat of the next outbreak. For there will be more introductions, and as long as we have fuel available, COVID will burn. We will be extending the youth vaccine campaign beyond this week, and as we move through communities for second doses of Pfizer, we will also be offering first doses. At this time, we're not planning a third visit to communities, but the good news is that youth who get Pfizer in the next week or so will be able to be offered Moderna for their second shot. We are now confident that the messenger RNA vaccines are interchangeable. A Pfizer shot can be followed by a Moderna and vice versa. In the meantime, public health measures are still in place to help reduce the risk of other outbreaks or spread of COVID within the territory. We all must continue to observe that safe 6+1. When you're at the grocery store, at work, socializing, make sure that you are following the safe 6 plus wearing a mask and are keeping yourself and others around you as safe as possible. As we move through these next few weeks, I ask that each Yukoner remember that the choices we make may influence another person's chance of falling ill. Our choices and chances of contracting COVID-19 are going to be dependent on the choices we make as well as the choices of everyone around us. Now, I recognize there are some people that may be worried about the many summer camps and events going ahead. I understand there's a fear over the intermingling of children and counselors and the risks for infection. I agree, there is a risk, which is why following of safety protocols during camp is going to be so important. But with careful observance of protocols, I have advised that the camps can proceed and our children can enjoy all the benefits that they can get from camp activities. Reinforced preventative and screening processes are being put in place to protect children, counselors, and families of both groups. Active screening will be a huge part of our process. Both staff and campers before attending camp will be screened prior to the beginning of the camp day. We're working closely with camp leaders to reinforce the best practices that need to be adhered to, while the kids can learn new skills and have fun doing so. Many parents and caregivers are dependent on camps to provide care and fun as they continue to go to work full-time. Similar to summer camps, for any events coming up this summer, as the Premier referred to, we are working alongside event operators and coordinators to develop or revise their plans. And we're continuing to offer advice based on the event, the location, and the attendance to evaluate the level of risk for any events to proceed. As the Premier mentioned, the Porter Creek grad event was the one event we had to cancel based on its unfortunate timing around the outset of this outbreak and its potential to amplify a rapidly evolving outbreak. Although some organizations have also chosen to cancel their events, my goal is to support any events to proceed in as safe a way as possible if the organizers are willing to continue. For many months, almost as on a pedestal with our zero active cases and high vaccination rates, all eyes in Canada were on us. And now the same eyes are on us for a much different reason. A highly vaccinated territory is undergoing the most significant outbreak since COVID-19 began. These next few weeks will help to determine our future, as well as help many other jurisdictions learn how we manage an outbreak amongst a highly vaccinated population. And I can understand that anxiety that Chief Bill referred to and that many Yukoners feel right now. There's anxiety about what might be next, how many more cases we might see, whether more people might get sick or die. We have to acknowledge this anxiety, but our response is to manage the outbreak and stick to the current rules, not to lock up, close doors and borders, or retreat to our homes in fear. Outbreaks will continue to be part of our new normal. Vaccine has allowed us to begin that difficult and rocky shift from pandemic into endemic. In making that shift, we must adjust our approach in how we predict, manage, and control outbreaks. Our solutions cannot be reliant on lockdowns and ever-tightened restrictions. We have always tried to play that balance of risks between being overshut down and too exposed. Right now, we have some homework to do as we concentrate on containing this outbreak. In the medium term, as the risk of severe outcomes from COVID decreases with vaccine, and as the situation in Canada steadily improves, that gradual opening up to support well-being and our mental health is a journey we will continue. For now, it's Safe 6+1. As we phase out of those measures, there will be certain elements we should always keep of the Safe 6, hand washing for one, and staying away from others when sick, even continuing to wear a mask in certain situations. But almost certainly, vaccination against COVID-19 and a need to keep testing will remain part of our lives for months and likely years to come. Our new normal will carry the risk of outbreaks from time to time, and what is up to us is how much further we can reduce the risk of outbreaks and the impact that outbreaks carry by steadily increasing our vaccine uptake rates. Clearly, even 72% of fully vaccinated adults is not quite enough for us to tolerate an outbreak. By getting our youth to high vaccine uptake, and by pushing our population to 80% fully vaccinated and beyond, then the impact of future introductions will become less and less. This pandemic has uprooted so much of our lives. It's caused sickness, separation, angst, and death. A post-pandemic life seems hard to fathom when we are undergoing a significant outbreak. It may seem odd as I discuss this now, but we need to take this into consideration, that our path to recovery will not follow an easy straight line. As we continue to vaccinate and test, our path back to normalcy could be long and erratic. Over time, this will become easier. And as long as vaccination rates continue to climb, we will be in a much better situation for the next challenge ahead. So let's carry on with the work ahead by doing the right thing, following Safe 6+1, including, as Chief Bill outlined, avoiding risky gatherings, getting tested, staying home and away from others when sick. And as always, as true Yukoners, looking after each other with kindness and respect. that's it for today. Be kind, stay well. Thank you. Shonetan, Ganashish Masucho, et merci.
Thank you. We'll move now to questions from reporters, and we'll begin with the reporter in the room, Vincent, Radio-Canada.
Bonjour. Docteur Hanley, première question. Il semblerait qu'il y ait eu une plus forte présence au centre de vaccination à Whitehorse cette semaine. Vous l'avez mentionné et de ce qu'on m'a dit, il y aurait eu beaucoup de premières doses. Est-ce que vous avez des chiffres qui le confirment? Est-ce que vous pouvez confirmer cette tendance? Et surtout, quel est votre regard sur le fait que peut-être cette éclosion de cas de COVID-19 pourrait avoir poussé certains Yukonais qui étaient jusque-là un peu hésitants à se faire vacciner?
So, Dr. Hanley, there was a surge at the vaccination clinic this week, and it seems that many of them were for first doses. Do you have numbers on how many of these were first doses? And what is your general take on what it means and what you're projecting going forward with this phenomenon?
Merci Vincent. On aura le chiffre bientôt. Je viens de recevoir quelques chiffres, mais c'est vrai qu'il y a un incrément, une croissance assez importante. Dans l'endroit de 900 Yukoners dans la semaine passée qui ont reçu une dose de vaccin. Donc, c'est bien augmenté et on voit la même phénomène dans chaque communauté, qu'il y a une demande pour, non juste pour les deuxièmes doses, mais pour les premières doses. Donc, si c'est une motivation, c'est vrai que peut-être c'est la motivation qui quelques personnes en avaient besoin de voir que, comme Chief Bill a dit tout à l'heure, que c'est vrai, le fait de COVID, c'est vrai et c'est présent dans notre communauté. Donc, je pense que c'est ça qui a poussé des gens. Mais on va avoir des chiffres plus spécifiques pour plus tard.
May I ask you to repeat that in English, please?
Yeah, I shouldn't be quoting Chief Bill in French. That wasn't fair. I'm just saying that for many, the motivation that people needed was, Chief Bill was saying just before this conference how that for many people COVID is real, or that realization that COVID is here, COVID is real, is what pushed them to get vaccine. And I think that's true. And we did see around the territory a significant uptick in demand. And I said, I was handed some figures. I'm going to take some time to look over them, and we will be distributing figures. But it's in the order of 900 Yukoners in a week receiving first dose of vaccine.
Thank you.
Do you have Premier Silver something to add?
So if that's helpful.
Oh, sure.
Yeah.
Premier Silver,
Yeah,
please.
thanks, Pat. So total vaccines as of June the 17th, total is 57,017. First doses is 30,602, and second doses is 26,415.
Thank you.
Sorry, I will say in terms of percentage what we are at right now, 18 plus is now 82% dose 1 and 74% dose 2. Donc 90% première dose et 74% deuxième dose pour Yukon jusqu'au maintenant.
Thank you. Avez-vous une autre question, Vincent?
I will ask my second question in English, but if I can have both answer in French and English, that would be great. There has been concern this week again regarding the protection of personal information and the fact that this little card that we all have is not a proof of vaccination, as many Yukoners might think it is. At the airport, you still have to agree to share any information requested, and that could be even your full medical records. So I just would like to know why do we have these cards? Like, is it useful at some point? Because many Yukoners think it could be a proof. And now that, for example, Ottawa is asking, for returning Canadians that they can show a proof of vaccination on the website, on the platform. So what would be this proof if it's not the card? Thank you.
Sure.
We've the verification process is different than the card. Absolutely, and so we're experiencing difference in different provinces, different jurisdictions as far as what information is on that card. We also know that we have a digital connection to Vancouver, to BC, so it is very helpful just signing off and saying you can access my information to see if I'm vaccinated or not. The details about further medical records, I'm just hearing about this, and this is the second time that I've heard this as a concept. I don't know what specific other information is being asked, and I'll definitely be looking into that.
I'll just say in English, and then I'll give something in French. I think the card is really a reminder and a souvenir, but it is not. It does not pass grade as a verification. So when it comes to, for instance, the need to upload into Canada Arrive app for international, we need a way to take verifiable information from the record and upload it, and so that's kind of a process in the works. In terms of the verification for people coming in, it is based on consent, and I don't know about that question about access to medical records, so equally we'll get back to you. Juste pour traduire en français, c'est que la carte que vous avez montrée, c'est une carte plus ou moins pour un rappel et pour démontrer, mais c'est pas une vérification. La vérification on a pour les gens qui viennent pour établir preuve qu'ils ont les 2 doses de vaccin. Ça, c'est basé sur la permission de l'individuel. Et comme il s'agit d'accès de plein record médical, c'est la première que j'ai entendue. Je crois que ce n'est pas le cas, mais on va revenir avec les détails de ça.
Thank you. We'll move now to the phone lines with Luke from CKRW.
Hi, Dr. Hanley. I'm not sure if this has been mentioned at a previous update before since this outbreak started, but I'm wondering if there was ever an identification of a direct source for the importation of this P1 variant into the territory. I'm just curious if maybe it was just a travel-related case that might have slipped under the radar. I'm not sure.
Yeah, thanks, Luke. And I would be very surprised if we ever find the source. Usually we don't, and the reason is that the gap between the actual introduction of the source and then the detection of cases is usually after 1 or 2 generations of transmission have already occurred. So what we're picking up is the after effect. And then to be able to trace back to an individual event or person becomes very difficult. You cannot piece together enough information to get that story, and that person is no longer waving a flag saying that they had COVID. So. What we do have is by looking at symptom onsets and incubation periods, we were able to backtrack so that we could estimate that the introduction likely occurred in middle of May, probably sometime around the Victoria Day long weekend. Of course, we can't pinpoint a day, but sometime in that area, and probably started to spread. Perhaps there was a traveler and there was transmission within a household, perhaps within a small gathering, and then probably a generation of transmission to a few others, and then it got augmented and strongly amplified through the gathering events that we identified in early June. So that's probably it. It's probably some kind of breach, whether intentional or unintentional, I don't know, of self-isolation of someone at some point around the middle of May, and that probably was the introduction event. And again, I think the important lesson is recognizing there always will be leaks and those introduction events. And what can we learn about this to prevent the amplification of an introduction into an outbreak?
Thank you. Luke, do you have a follow-up?
No, just the one question for me. Thank you.
Thank you very much. We'll move to Hina, Canadian Press.
Hi, Dr. Hanley. I had a question for you about this coming fall when international students are going to be starting to come in. And we've seen that a number of students will be coming in from countries where they still don't have access to vaccines, or they have access to vaccines that were developed in the Chinese-developed vaccine, which hasn't shown to be very effective. Do you think we in Canada should be worried or have a plan in place to deal with any potential outcomes? Because we are seeing how unvaccinated cases in Yukon are increasing.
Yeah, this is more a question for a federal government. The questions about countries and mobility there and restrictions and guidelines is in the federal purview. I know that our conversations with the federal government, we're starting to take a look at, we're giving them information about community connections in the United States first. That's kind of where the conversations are right now. But as far as any speculation, I mean, Dr. Hanley, you're more than welcome to answer the question, but this is definitely a federal purview.
Yeah, what I will say is that we have a history over the last year and a half of working very closely with Yukon College, now University, in welcoming those international students who have arrived, making sure that they have the information they need, assuring self-isolation facilities were in place, ensuring that they knew about access to testing. And our policy has been that anyone who is living or working or in Yukon has access to vaccine as well, and that's an individual benefit, but of course it's a benefit to our community as well. So if we were to have students coming in that were staying here and were not vaccinated by an approved vaccine, we would certainly be offering vaccine.
Thank you. Hina, do you have a second question?
I do, actually. And this is also about an international event. And Dr. Hanley, I was wondering what your thoughts are on the Olympic Games to be held next month in terms of whether this could turn into the next super spreader event, and what steps do you think Canada and Canadian athletes should be taking to make sure that we have as little impact as possible? Thank you.
Yeah, again, it's a question that's a little out of my usual scope. So I would say that in the Yukon context, what we do is my philosophy, as I said on my speaking notes, is to support events to go ahead as long as public health measures are followed, and encouraging ongoing vaccine uptake. In terms of what may or may not happen in the Olympics, I think it's a little out of my scope to speculate. I know there are many experts weighing in, and I just wish all the best for those athletes who do participate, and that the event is carried off safely.
Thank you. We'll move to Chuck, Whitehorse Star.
Yes, good morning, everybody. There's been a lot of numbers thrown around here, and I just want to get it straight. How many active cases do we have right now, Dr. Hanley?
Yeah, so I'll go back to the beginning of my media notes and then go over some of those. We have 103 active cases in Yukon at present. Was that the extent of your question?
Yeah, I guess it is. It's just I know that there was a little, there was a little on June 21st. You reported there was 100 active cases, And then on June 22nd, reported there was 92 active cases. So I just wanted to confirm. So today we have 103 active cases. All right. I gather, I guess my next question is, it's related to the people who have had both vaccinations and they're getting infected. Did you say that there was 2 people medevaced out and 1 was hospitalized here, an elderly person? Is that correct, Dr. Hanley?
Maybe I'll go over that, but the first thing, sorry, I just wanted to reiterate that numbers will be fluctuating because we have now we have new cases coming in. Those usually are often they are resulted through the night and then collected in the morning, verified, and over a few hours that number is verified and then added to the case total. Part of that is, verifying the story and also determining whether they meet Yukon residency status or not. And at the same time, we now have people recovering. And of course, we expect a lot of recoveries over the coming days because there were a lot of people infected more or less at the same time. So those will be affecting the numbers. So the numbers, as I said, that are posted this afternoon will likely be different from what they are this morning. In terms of hospitalization, let me go over, and I'm being a little bit more liberal with information just because we have a safety in numbers, as it were, but also because I think it's important to try to illustrate what is going on and how that matches what the evidence is telling us in real-world experience about vaccinated versus unvaccinated. First of all, that it's important to know that people who are fully vaccinated can still get infection, but at about a 95% lower rate. So sometimes when we see lots of cases, we will see. In this case, overall, we've seen 12 people with infection fully vaccinated, 11 of whom have mild or very mild symptoms. One of whom is an elderly individual in hospital in stable condition at the moment. So that's one recent hospitalized case. We have another person in hospital locally who is unvaccinated and who is in a serious condition. And we have had early on, those are the 2 more recent admissions. Then early on, I think even the week before last, announced 3 admissions at all very close together near the beginning of this outbreak. And 2 of those admissions were people who were medevaced south. Another one was a local admission. The one that was a local admission was partially vaccinated, had a short stay. I don't know how many days, but was stable and discharged. The two that were medevaced out for care out of territory were unvaccinated.
Thank you. Chuck, do you have another question?
Do I have another question?
He's had 2.
He's had 2. Okay, I just want to clarify. Because he followed right up on one. We'll move then to Jim from Yukon News.
Yes, I was just wondering if there were numbers available on approximately what percentage of cases in this outbreak have been youth under 17.
Yeah, I don't have it by percentage. That's something that we can work on and get back to you on. I know that there have been youth under 17. There have been several youth under 17, all with very mild illness and mild symptoms, as we expect with children and youth. But the exact breakdown I don't have with me at this point.
Next question, Jim.
No, that was my only question. Thank you.
Thank you very much. We'll move to Chris, CBC.
Hi, good morning. Thank you. I guess a question for Dr. Hanley. We have seen, given that this current outbreak has resulted in numerous communities experiencing positive cases, And given that many local, either First Nation or municipal governments have revealed that there are active cases in their communities, and given that you just said you're trying to be more liberal with some of this information, are you going to revisit this policy of not identifying which communities have active cases and how many cases?
So thanks. It's a really good question. It actually is a question currently on the table, and I'll tell you the reason that question is on the table. It's really, is it more convenient for the communities and municipalities? Does it enable them to be able to give information back to their own communities more easily? So I actually have brought that up as a question for the chiefs to consider, as well as the municipalities, and I will be connecting with them, I believe, today or tomorrow, to go over this. I think in terms of public health value, it frankly adds little. I think the most important consideration is that consider that it is present in your communities and act accordingly. I think that's probably the key message until we really harness and understand everything about this outbreak and get it back under control. We have seen several introductions into many communities, and I suspect that there are others that we have not yet detected. So I think the key message public health-wise is consider it's there and test if you have symptoms. But for kind of a practical value, it may be an advantage, and I leave that for the communities and chiefs to consider.
Chief Bill?
I can answer part of the question from my perspective anyways. We believe that having that information creates more of an awareness in the community. People are more vigilant, and they take the precautions seriously when they know that it could be just down the street type thing. From when we started this pandemic a year ago, it was very, very difficult and very, very stressful dealing with the situations in the community, because back then we had no cases and people were not taking it seriously at all. And it was stressful for us, as leaders, trying to shut down parties, trying to get that message across how dangerous this can be, and just trying to encourage people to get vaccinated and all of those things. It was very, very difficult and very, very stressful. So now that people are aware that it's in the community, they're taking this seriously, and I've seen it. I've drove around the community in the last week or so, and I see that there's nobody out. People are keeping within their bubbles. People are taking the measures seriously. You're always going to have a certain element of people that don't in any community. But you do what you can to try and urge them to take the precautions seriously.
Premier Silver?
Yeah, I completely agree. And I think, too, when we first started down the road of the policy of limiting the amount of information that doesn't necessarily, and at those times, help the health and safety, but it was a lot of more, COVID was new, and, a case in a community back early days. We were worried about the ramifications of those things. Now, and it was abundance of cautions from Dr. Hanley to give that information to the leaders in the communities and let them to decide what they want to do with that information. What we've seen is a lot of the mayors and chiefs are sharing that information. So now we're going back to the table and saying, would you like a centralized approach to that? Again, respecting the leadership of the mayors and the chiefs in that dialogue is now live.
Thank you all. Chris, do you have a second question?
I do. Thank you, and thank you, Chief Bill, for that. My next question, I'd like to hear from both Dr. Hanley and Premier Silver. Chief Bill's free to weigh in, of course, although I suspect this mostly falls on the Premier and the Chief Medical Officer of Health. And that is that, given since this current outbreak has begun, you, granted, have increased inspections and enforcement of existing regulations, but you've repeatedly said that there will be no new, at least for now, there will be no new restrictions brought in or brought back in. How much personal responsibility do you think you bear for the new cases we've had since the outbreak began and the cases we'll continue to have?
I don't know about the personal responsibility part of the question. I'll answer the way that we've been answering every single recommendation that we've put forward from the beginning of the pandemic. We don't make decisions politically. We make decisions based upon the best information from the medical community. Dr. Hanley and his team are plugged in on the national conversations, jurisdictional conversations, sharing information about traceability of the virus, what measures we need to put in place to make sure that we keep our communities safe. I think the Chief Medical Officer today was very eloquent in defining the balance between our mental health and the ramifications of an outbreak. And I believe that we've approached it from a very measured perspective, a very scientific perspective. Do we get everything right all the time, Chris? No, we don't. But at the same time, I would much rather follow the recommendations from the medical community, from the Chief Medical Officer of Health, than, let's say, for political expediency or bowing to pressure from people that are nervous or fearful. And so, this will be the best approach, is to continue to follow the guidance and the recommendations. You're questioning whether or not we bear any personal. When you take public office, when you take these positions of leadership, then you're always in a position where your decisions are going to affect the outcomes. Absolutely, that weighs on me heavily every day. But I think our approach is sound, and I think that the team at Yukon. At the health department, YCDC, the Chief Medical Officer of Health have given us absolutely amazing professional advice at every turn. These folks don't sleep. They've been at it for months, and I'm sure it weighs very heavily on them as well when they make the recommendations and when they start implementing the guidelines, and even ECC folks, the enforcement folks, everybody. This weighs on everybody for sure. I think everybody has a piece of personal responsibility in our decisions, and I stand by our decisions.
Thank you, Premier Silver. Dr. Hanley?
How long do you want to be here for?
Not very long.
Okay. I agree with everything the Premier said, and I think if one takes a position like this, then one has to be willing to take a stand and to make recommendations based on the best evidence that we can muster, the best expertise that we can put together. And in my position, everything I do is for the well-being of Yukoners. And there is no risk-free approach. This is not risk on one side, no risk on the other side. Look at the mental health consequences of restrictions. Look at suicide. Look at addictions and how addictions have been aggravated. Look at alcohol injury. Look at opioids and our increase in the opioid crisis since the onset of this pandemic. So yeah, does it weigh on me? For sure it does. And that is why striking the right balance based on the best evidence at the time is so critical. And yes, our goal in this epidemic is to stand with those who are vulnerable and those who are unvaccinated, and make sure we do everything we can to protect them. And that is what we are doing right now. And it's to use the fact that we have so many people who are unaffected by this outbreak to give us the power and the resources to concentrate on those who are more vulnerable. And that is the goal, is to do our best to protect those who are unvaccinated by encircling this outbreak, by testing, by contact tracing, isolating cases, and all the while promoting vaccines so that as a society we can withstand this better the next time around. But don't think that there are not consequences to public health restrictions. I think we all know that there are serious consequences, and our goal should always be the least intrusive measures that we can put together to achieve the outcomes that we need for the well-being of our people.
Thank you. On va maintenant passer à Laura Boréal.
Oui, merci. Ma question est plus pour Saint-Sylvain. Il y a plusieurs Yukonais qui profitent justement des longues fins de semaine pour aller explorer le Yukon, les régions, les communautés. Certains se sont fait dire d'éviter des commerces dans Range Junction la dernière fin de semaine. Je me demandais s'il y avait comme une façon, une liste sur le site du gouvernement du Yukon, justement pour que les Yukonais peuvent consulter avant de partir, pour être certain que ce soit clair, qu'ils mettent personne en danger.
So the question is for Premier Silver. There was a number of advisory in terms of traveling to communities in a respectful manner. Many Yukoners want to be able to explore the Yukon. Is there a list of commerce that they can go to in communities or places where they will be welcome that would be available on the website of the government of Yukon?
Thank you very much, and thank you for the question. You know, again, as far as canceled events, we talked about the only event that we've canceled through the recommendations from the Chief Medical Officer of Health. We know that the Chief of the Untitled has some requirements for travel up there. I would urge you to, get in touch with his government if you want to know more about, those requirements. I want to do a shout out to Trondheim, who has done an impeccable job of communicating with travelers in the community. A big shout out to Mabel on the road there, who's been doing an amazing job, one of our elders in the community. Again, when we talk about as a government traveling respectfully into communities, it's all about again, the Safe Six and making sure that you, as you travel, whether it's for the Great Yukon Summer or for business, for whatever reason, you just got to make sure that you tread very lightly. You be very respectful of the community. If there are checkpoints up on the highway, please stop and talk to these amazing folks. It's all about a community feeling. It's all about making sure that in each community, when you are visiting, the community itself has to feel safe. As we feel more safe, it helps our mental health. It helps also the connections between leadership as well. I've been in this job of a political job for 10 years now. I've never seen our communities so connected from a leadership perspective. And so when we talk about traveling respectfully, it's based upon what Dr. Hanley hears on weekly calls with the chiefs and also with the mayors and on our team as well, and the conversations that we're hearing. So it's about respecting the wishes of leadership in the communities, but again, I do urge folks to make sure that they reach out to the individuals, the leadership in the communities, the mayors and councils, chief and councils as well, if they have any concerns or issues that they can't garner off of our website.
Thank you. Avez-vous une autre question, Laurie?
Non, merci.
Merci.
Merci. I'd like to thank everyone for their time today. The regular COVID-19 update will take place on Wednesday, June 30th at 10:30 a.m.